Brain stroke or the cerebral vascular accident. It is the disease or pathology in which the blood supply in the brain is reduced due to obstruction in the flow of blood through the cerebral vessels, arteries. It is of two types: ischemic stroke, in which there is clot formation, thrombus, and emboli. They are the causative factors which produces the reduce or the reduction in the flow of the blood, and hence provision of reduced oxygen and the nutrient towards the center of the brain. And second type of stroke is hemorrhagic, which is mainly due to the high blood pressure, and there is traumatic injury, aneurysm, and the various diseases of the vessels, due to which the walls of the arteries become weakened and there is leakage of blood in the tissue of the brain, and that blood produces pressure effect over the tissue, and the result is the diminution in the reduction in the functions of the affected area and subsequently death of those centers or the portion of the brain. The various diagnostic procedure is blood examination test for C-reactive protein ESR, and the lipid profile is performed to calculate the value of the bad cholesterol in the blood, which is responsible for the atheroma formation, atherosclerosis in the vessels of the wall of the vessels of the brain, arteries of the brain. Then there is the CT scan, PET scan, MRI, and ultrasound of the carotid arteries in the neck, which convey the blood stream towards the cerebral arteries. So these are the basic factors. In addition, we also perform the cerebral angiography and angiogram to study the inner wall or the lumen of the cerebral arteries, so that we can also calculate the location and the size of the clot formation, which has to be removed to maintain the normal flow of the blood. Treatment of the stroke. It is an acute medical emergency. Without loss of time, we have to seal up the leakage of the hemorrhage in the cerebral walls, and also to remove the clot which is obstructive, that has to be broken into pieces or is to be removed as a whole. Medical treatment immediate is IV administration of TAP, tissue plasminogen activator enzyme IV, which break down the clot formation into the pieces, and that is removed from the brain. In addition to this, this procedure should be adopted as early as possible, within few hours, within 2 or 3 hours, to save the normal function of the brain. We can also administer TPA through the catheter direct to the location of the clot in the cerebral arteries. It is an immediate action of the enzyme that break down the clot into the small pieces and to maintain the normal flow of the blood. In addition to this, there are surgical procedures. We pass catheter through the artery into the cerebral arteries, through the groin artery, and also pass a device to remove the clot as a whole by this device. And similarly, we can also produce the operative surgery, open up the skin, and we extract and drain out the leaked blood in the tissue, brain tissue, from the vessels, and to seal up and stitch up the leaky cerebral arteries. So these are the basic medical and the surgical procedures. In addition to this, we can also implant stent if there is narrowing of the vessels due to other procedures like atherosclerosis. Then we have to also implant or placement of the stent is also performed. For prior to this procedure, we have to do angiography to get angiogram, and we also try to angioplasty, that is the dilatation of the vessels by the balloon angioplasty. And then next is when the narrowing is of the vessel is too much by the atheroma formation, atherosclerosis, then we also insert or implant the stent. When there is ischemia due to atherosclerosis. But when there is clot formation, that is that material of atheroma has burst into the lumen of the, then we have to remove surgical through catheter device or immediate medical infusion of the C.v.a. enzyme. So this is the basic procedure which are performed to remove the clot, to maintain the lumen of the vessels, cerebral vessels in atherosclerosis, and to seal up the leakage of the vessels, and to remove the the blood collected from the leaky vessel in the tissue of the brain outside by the surgical, the craniotomy is performed and the evacuation of the blood is done.